Case 14. A 19-year-old college student comes to the university health clinic complaining of muscle aches. She recently began an exercise program to lose the 6 to 8 kilograms, or 13 to 17 pounds, that she gained over the past year. After her first day of weightlifting, however, she became extremely sore. Several hours later, her urine was the color of cherry soda pop. Physical examination is unremarkable. Laboratory tests reveal a serum creatinine kinase level of 93,970 international units per liter. Urinalysis is negative for blood and positive for myoglobin. What is the most likely diagnosis? McArdle disease. This is a type 5 glycogen storage disease. Other glycogen storage diseases include von Gerke disease, which causes severe fasting hypoglycemia, Pompe disease, which is characterized by cardiomegaly and early death, and Cori disease, which is less severe than the von Gerke and has normal lactate levels. What is the biochemical defect in this condition? McArdle disease is caused by a deficiency of muscle glycogen phosphorylase. Although glycogen formation is not affected, glycogen cannot be broken down to glucose, which is glycogenolysis, because the alpha-1,4 glycosidic bonds cannot be broken in the muscle to release glucose 1-phosphate. What are the most likely liver and muscle biopsy findings? A liver biopsy is normal as the defective enzyme is present only in muscle. Muscle biopsy shows accumulation of glycogen. After the patient completes an exercise tolerance test, her lactic acid levels do not increase normally. Why? Lactic acid is a product of anaerobic glucose metabolism. Failure of lactic acid levels to elevate after exercise is an indication of a defect in the metabolism of glycogen or glucose to lactate. This response can be seen in other disorders of glycogenolysis or glycolysis as well. What accounts for the color of her urine? Her muscles begin to break down during exercise because of the lack of glucose. This causes myoglobinuria as well as elevated creatinine kinase. Her urine will be positive for blood on urine dipstick but will be negative for RBCs. What is the most appropriate treatment for this condition? Oral ingestion of sucrose before exercise has been demonstrated to improve exercise tolerance and reduce the risk of myoglobinuria.